Welcome to Healthcare Without Scrub. I'm your host, Ness David, and thank you for joining us in today's episode where we are going to talk about the role of the PCT, sometimes called the patient care technician, nursing assistant, or CNA, certified nursing assistant. So we are going to talk about the role of the nursing assistant in care coordination. And today I have a wonderful guest with me here who is an experienced CNA, and she's going to share her experience with us and also give us a little insight into what they do and then sometimes the trajectory or where they go from there. So join me and let's welcome our guest today. Our guest is Anna. And Anna, welcome to the Healthcare Without Scrub show.
Thank you.
And we are happy to have you here. Thank you for joining us. Would you like to tell us a little bit more about yourself before we continue?
Yes. Hello, my name is Anna. I've been a nursing assistant for about 3.5 years now. I work at a local hospital in Seattle. I first got into it when I was about 18 years old, fresh out of high school. I wanted to get experience in the healthcare field, so I thought nursing assistant was a great way to do that. And I applied to a nursing assistant school, got my certificate, and then got a job right away. So
thank you. Thank you for introducing yourself to us. So before we get into our first question, I have some PCT or nursing assistant jokes that I want us to try here. Let's see how it goes. So our question to you is the CNA motto: if at first you don't succeed, you do what? Call the nurse.
That is true. That's true. Yeah,
I agree with you.
I
remember even as a nursing student, I used to, like all the time.
Call the nurse.
Call the nurse, right?
Yeah.
And then you become a nurse and you're like, no, I'm now the nurse. I got to call myself,
That's
right?
That's my go-to saying, yes.
Let me get you a nurse.
Let me talk to your nurse.
I think it's like a free get out, card that you always use to get out.
Any complaining, anything. Let me talk to your nurse.
Let me talk to your nurse.
Yes.
Oh, I guess. And hey, sometimes the nurse will go like, let me talk to your doctor.
Yeah, exactly. Going up the chain.
Going up the chain.
Yeah.
Okay, so thank you for joining us, and let's get into our issues today. Can you first of all tell us about the role of a nursing assistant? What do you remember about maybe some of the roles, things that you do, as part of your job?
Yeah. So as a nursing assistant, we're there to assist the nurse. We obviously can't give out any medication or anything like that, but we assist in helping the patient go to the bathroom, helping feed them, helping turn the patient, cleaning the patient. So if they're, not able to shower or anything like that, we'll do a wipe down, mobility. So going on walks, those are mostly roles as a certified nursing assistant. As a patient care technician, we have a few other roles such as taking blood sugar, doing an EKG, bladder scanning. So there's a few other things that a patient care technician can do that a nursing assistant can't, but that's usually the kind of scope of practice that we have.
Oh, thank you. And then I'm glad you did explain the difference between, the roles that a nursing assistant does and a patient care assistant also, right?
Yeah.
You have some additional roles that I don't know if they are allowed to take out catheters. I know I used to work in a place where we're registered NACs but trained to be able to take out catheters, including blood sugars, and then they call us medical assistant. But I don't think it's really the scope is quite limited compared to a real medical assistant.
Yeah, but I agree.
Yeah, but anyway, thank you for explaining that. And you did mention about what influenced you into getting into becoming a nursing assistant or a patient care technician.
Yeah.
Can you go over that with me?
Yeah, of course. Yeah. So all throughout high school, I kind of knew I wanted to go into the medical field. I loved science. I loved biology. So when I graduated high school, I decided to go to a nursing assistant, training, if that makes sense, to get my certificate. And then a few months later, I was able to find a job at a hospital, which was really lucky because I think majority of the time they like to see that you have previous experience. But I didn't have any, and luckily I got a job right away. I found myself on a medical surgical floor, which was really nice. So I got plenty of experience with different types of patients, tubes, lines, and that helped me kind of gain experience in the medical field. You know, also see different professions in the medical field because there's so many besides doctors and nurses. So that kind of helped me navigate which profession I wanted to pursue in the future.
Yeah, yeah. And then what are some of the areas that, like, for a PCT, somebody who's trained as even a nursing assistant or PCT, what are some of the areas that you think like a person can work with that kind of certificate?
Yeah, so definitely nursing homes, a skilled nursing facility as well. So patients that came from a hospital and then need care, but don't necessarily need to be in a hospital, they'll go to a skilled nursing facility. So I think, nursing assistants can work there. Again, a nursing home. So, where elderlies kind of go when it's almost their time to pass. What else? I know there is private practices where they will send nursing assistants to homes directly, and then they'll work there with one-on-one with a patient. Obviously, hospitals. So there's a few different areas where you can.
And I think assisted living homes as well.
Yes, correct. Yeah.
And I remember my years as a nursing assistant, I did work some agency jobs that took me to patient home.
Yeah.
I wasn't a big fan of that just because sometimes you have to cook for them. And, being an immigrant, I was used to my culture kind of food. And then I have to cook this American food that I have no idea.
Yeah.
And that scared me a lot, when they also were not knowing how
to cook.
how to cook the food they want and stuff like that. Yeah. I don't want to,
Not for you.
poison anybody with my terrible American style of cooking, right? So it wasn't for me. I preferred not to work in areas so that I didn't have to do that. So for the patient. Yeah. And then I think besides working for agencies and going to people's home, I also know of I don't know if they do. I think we can do live-ins too, where they sometimes stay with some people go to, hide by the family and stay with the patient.
Yeah, I've had a colleague who did that previously before working in a hospital, and they would work one-on-one, like live with them, and then also take care of the patient.
Yeah, and I must say you are very lucky that your first job was in the hospital, because I remember when I applied, when I finished my training as a PCT, what happened was the hospitals were not hiring directly from school. So because they wanted you to have some acute care setting experience. And so they even when you work from, like, let's say, nursing home, if you work in assisted living, they didn't want to hire you. They wanted you to be from like a skilled nursing facility, like nursing home and stuff like that.
Experience. No, I agree. I was actually shockingly surprised that they hired me on directly, but I'm not going to put things there.
And how was that? So was it like, so with me that I ended up going to the skilled nursing facility before coming to the hospital setting. There were certain things I was already exposed to, in the nursing home. So it wasn't a difficult transition for me. How was it for you?
It was, so I got on the job training, which was really nice. I think the certificate class that I did for CNA, it doesn't teach you everything that you see in a hospital. That's more on the job training. But I think the training that I got definitely prepared me. The first day being alone with, an X amount of patients was really scary. But after the first day, it's like, okay, you just get into a rhythm and you get used to it. And it's not, that scary. And asking a lot of questions is really good too. I tend to ask a lot of questions, which helps a lot because, people will then help you out. So, for the future. So that was just.
And then let me track back a little bit here about, how you getting into this position, right? How was the schooling?
The schooling, So the school that I went to is located in Federal Way. It was a month-long program. It was in person. Well, half of it was actually online. It was right in kind of the COVID ending era. So half of it was online, half of it was in person to do, skills, and then also for clinicals. So the last week of that program, we went to a hospital and did, skills in person, shadowed an actual CNA working in a hospital. And I think there you also learned a lot of skills that you kind of needed for the hospital as well. So yeah, it was a 1 month long program and it was super fast. And yeah, it was, I mean, you learned a lot.
I remember mine was, I did mine when I lived in Ohio. And I remember the class, it took longer than, I know some people even do like 2 weeks program, fast track program, but mine was more like a part-time thing. So it took me longer, right? I think it was maybe 6 weeks or, so about a month and a half, maybe, to do the training. And then, was it your first time training anything related to the medical field?
Yes. Okay. Yeah, because I was fresh out of high school. I was 18. I was a baby. And it was anything, hospital related. I'd never worked in a hospital. I hadn't even volunteered in a hospital. So that was my first experience ever. Yeah.
And what was your impression when you were first being told about the tax you would have to do?
The tax, how the hard work?
Your job description.
Yeah, no, it was definitely, I love taking care of people. So it wasn't like, a burden or anything like that, but it was definitely a lot. It's a lot of work. It's very laborious. You're on your feet all day. You're, heavy lifting and things like that. So that was definitely kind of like I'm going to be exhausted type of thing. But, it wasn't a turn off or anything like that.
So there was nothing scary, right?
No, the only thing I saw was one of the patients the week I was shadowing, they're like the last day, in the last hour of my clinical, there was a deceased patient on the floor and I had to do post-mortem care. And I was a brand new CNA and I was like, I have no idea what I'm doing.
Yeah.
That was the one scary thing. But other than that,
an interesting story I have about that is I remember my first job, after training, was in a nursing home. And the first night, there's this guy that just was admitted to the skilled nursing facility from a hospital with a fresh kind of peg tube. And in the middle of the night, he pulled it out.
Oh.
He ended up passing. That's a sad story about it. But the interesting thing is that it was my first night. We had one experienced CNA, and then the nurse who was on duty was her first night by her own after orientation.
Oh gosh!
And she was lost, screaming. I mean, they were when we called 911 when EMS came, the paramedics. So they wanted to start a CPR on this patient, and they asked the nurse, what is the patient's code status? And she didn't even know. She was so confused and lost. I can't forget that. It was chaos. The other CNA was also new. She couldn't look at a deceased patient, so she was crying and ran out of the room. And I was left there with this old experienced CNA, and then this new nurse was like also lost, shivering and almost crying, and it was chaos. It was chaos, but eye opener, In my training also, I remember we had this guy that also was an immigrant just like myself, and he didn't know what the job entails, like the job description. So in our first, I think second or third class, when he realized that we were going to be wiping butts, I remember vividly that he said, I will not even wipe my grandma's butt.
Oh my gosh. And then the job is not for you.
And he walked out of the class and never came back. I've never seen him again. And just like you said, this is not a field for you. If you are somebody who, get gross out or worried about, things like that. I don't think it's a field for you.
For sure. I think it takes a certain person to
And that's the thing, right? People sometimes people only look at the money part of it and go like, oh, this is a good starting point for my life. Let me go, get it. And they get in there and realize this is not for them.
No, I agree. Anything in the hospital, I think, is you need to be able to do it from a standpoint of you're taking care of people, and that should be your motivation instead of the money. Because at the end of the day, you are not going to like your job if you're doing it for the money.
100% agree with you. 100% agree with you. If you're thinking about, and at the end of the day, these people need to be cared for.
Of course.
And if we are all going to say, oh, this is gross and I don't want to do it, who is going to support them in their most vulnerable time?
I agree.
And you don't know the weight of it until, it hits you. If ever been a patient and you realize how vulnerable you are and how much you need somebody to be there for you.
And being cared for. Yeah, I totally agree.
I don't know if you've had this experience. I've had experiences where even the family members are grossed out by the patient's condition and stuff like that. And we have to step in.
For sure.
Yeah,
it's like you're kind of a family member for the patient. For sure.
Yeah, and it's a hard work. It's a hard work. As a nurse, you do some of it, but PCTs carry most of it in terms of the direct patient and hands-on patient care, right? And I always applaud you guys. I've been there, so I know how challenging it could be and stuff like that. And so I always applaud you guys. I think you guys do amazing job, And so in terms of, getting a patient to where they are supposed to be, how do you guys' role play, or how do you guys' role play in that process?
So a lot of the time it's mobility, feeding, and then making sure they're clean. So obviously if they are soiled, we want to get them clean. That is a big part of our job. So if they've had a bowel movement or anything like that, if their sheets are dirty, we clean all of that. I like to say we do the dirty work.
That's true.
So we get them clean. And then there's also feeding. Some people or some patients obviously have peg tubes and they have feeding tubes. So that is not an issue. But, others, they need to, intake certain food and amount of food, because you can't heal properly if you're not, eating or drinking. And then another big one is mobility. So I hear a lot of doctors, if you want to get out, if you want to be discharged, you need to be walking. You need to be getting up and walking. And you see a lot of patients who don't want to, they just want to lay in bed all day and just go. But at the end of the day, it's like the doctors are right. If you don't move your body, your blood's not going to be flowing and you're not going to heal properly. So you need to get up, and even one walk a day, even 2 walks a day, one lap around the unit is totally fine. But, baby steps, some patients had huge surgeries, which is totally understandable to not be walking a mile a day. But I think it's definitely beneficial to the patient to be walking. And that's a big part of our job, is to make sure that if they can walk, if they need to walk, that we are able to go on walks with them.
And then very important in their healing process, right? And just like you said, sometimes you have patients who are like very reluctant. And sometimes it gives you a hard time, right? Do you have any interesting story that you think you could share with us about, your experience with a patient that personally, I think one of the things that we don't talk about is if it stinks in the room sometimes. And I don't know about you, but sometimes it's bad that you have to hold your breath, cleaning the patient up and stuff like that. And I'm thinking, am I the only person holding my breath in?
No, definitely not. And a lot of, nowadays the mask requirement has lifted and a lot of people aren't wearing masks, but I still wear mine for that reason, because I just don't want to smell, I still can smell it through my mask, but I'm sure with it off, it's going to be a lot more potent.
I've seen some people like on especially on social media would come up with suggestions like wearing 2 double masks and then putting like this, the scented those nice smell in between those 2 masks, so that you don't really get the direct
smell. I've also heard peppermint oil. You can put it under your nose and
stuff like that. I don't know. I haven't tried it before. I've heard about it. I haven't tried it. I don't know how that helps. But I think it's interesting to have that.
Yeah, for sure.
And do you have anything that you can think about that you think happened to you that was funny?
There was a patient who was very elderly, very confused, hadn't got out of bed in a few days. And another thing that we do is we work with PT if they need help. If the person is,
which PT is like physical therapy.
Sorry. Right? Yeah, physical therapy.
Just for those who don't know what PT is, physical therapy.
Sorry.
It's okay.
We'll work with physical therapy to just help them get out of bed. And this certain patient, hadn't got out of bed and was very unsteady on his feet. So physical therapy asked me if I could assist. We get him to the door frame and he starts having a bowel movement while he's on his feet and starts urinating and peeing all over the floor. And, we're in a hallway where other patients are walking and the nurses are walking by. And it was a disaster. We had to, get a chair behind him. He's still having a bowel movement. It's just, I feel like the funniest stories are when there's like a big mess.
Yeah.
In the moment, it's extremely stressful. And it's like, but then you look back and it's just like, oh my goodness.
Yeah.
Like,
and sometimes, like people would say we appear insensitive, but the truth is that as much as, these stories, are funny later when you look back on them. In the moment, you do care about the person and you feel like you're bad for the person because it's not easy just, walking and then not being able to control your bowels or your bladder.
Yeah.
But then when you look back and, after the whole thing, when you look back, sometimes these things are funny, right? It's like,
exactly.
Oh my gosh, it was just such a big mess.
Yes,
right?
exactly. Yeah.
I remember having somebody who had a big bowel movement, explosive, all over the place because they were on lactulose, right? And it was literally from the feet of the bed to the head of the bed and dripping. And so I went in there and staying so bad. I was holding my breath. And whilst I was rolling the patient said, like it stinks in here. And in my head, I'm like, wow, that's
from you.
I mean, if you can smell your own stuff, you can imagine what I'm going through here. Yeah, like, I didn't say that to the patient, but I was really holding my breath.
Yes.
So, it could be challenging.
Yeah, for sure.
Yeah. And so, if somebody want to get into this field, and we sound like it's all not fun, right? What would you advise the person to do in terms of to prepare to get into this field?
Yeah, for sure. It's hard to say gain experience because I feel like you gain experience by being a nursing assistant, but maybe if you can volunteer in a hospital, try and see what they're doing, or even just communicating with other nursing assistants and say, hey, what's your day-to-day routine? What do you see in the hospital? Things like that. I think that is beneficial because, being a nursing assistant, you're kind of at the bottom. You know what I mean? That's where you start. And that's kind of, a starting point for a lot of careers if you want to build yourself up in the healthcare system, if that makes sense.
Yeah.
But I would just say, if you're interested in it, go for it. Luckily, the program is only a month. And some hospitals even pay you to go and do the program. So they'll pay for your education, which is nice. But just, asking questions, doing your research. So knowing that you're going to be cleaning up a lot of poop. So yes.
I also feel like, getting into the healthcare, field, especially when you want to be a nurse, you want to be a physical physician assistant. You want to be a physician and stuff like that.
Yeah.
I think it's always good to have that experience because, it's nice to see that maybe a doctor walks into the room and they don't freak out because the patient started throwing up or the patient started having a bowel movement and they freak out. I've personally seen a doctor who ran out of the room and said, nurse. And then I was a nursing assistant by then, so I rushed to the room and what's going on? And said, oh, she's having a bowel movement. Like, you know what I mean? Like, this is not something to freak out about.
Yes, I agree.
And so I think if that doctor, I believe if he had experience, as a PCT, in the early years or even as some kind of medical field experience, that would have made it easy for them not to freak out about,
I agree.
a patient throwing up or having a bowel movement, right? So I think it's a good step to take if you want to get into the medical field to becoming to become a PCT.
I agree.
I don't know.
Yeah.
My opinion is that when I was a PCT or a nursing assistant, I love working with nurses who had experience, especially those who have experience and use that experience to help out.
I agree, and I feel the same way. You can definitely tell the nurses that have worked in as a PCT or CNA, and those that haven't, because the ones that have not delegate a lot of work to us, and they will act like we do all the dirty work, and they all have to do is just give meds.
Yeah.
And that's it, and which is not the case, because in healthcare, everything is a team, team based.
Yeah.
So you help each other out. Obviously, I can't give meds, but if you can help me turn a patient and I can help do a blood sugar, like different things like that, it's all teamwork, and it makes the job way easier. As soon as the nurse makes the nursing assistant, do everything, it's just it makes our job harder. It makes us, more tired and everything. So, yeah.
Looking back, is there anything you would like, thinking you would have done differently? I know you plan on becoming something else in the future. What's that?
Right now, I was pre-med, so I wanted to go to medical school, and now I'm thinking physician's assistant. I'm still kind of juggling the two, trying to figure out which one I want to pursue, because it is a big decision. But I'm taking a gap year right now just to figure it out. But I have done my bachelor's. I studied biology, so I do have that degree. But yeah, that's
and that is a good thing, right? Like just like you were saying earlier, right? If you're planning to become either a PA or go into medicine, it's good that you're having this background.
Yeah,
and I would
sure.
encourage anybody there, if you're a young person, a young student, and then you're planning to go into the medical field, I think it's not a bad idea to get some nursing assistant license or even volunteer, like you're saying.
For sure.
Either in the acute care setting or in the hospital, and then get some experience, get exposed to what the nature of the work, and see if it is something you would like, because you only are helpful if you like what you're doing.
Exactly. Yeah. And I've seen many nurses who I can tell they don't like what they're doing. And it's extremely hurtful to the patient, not only physically, but because I have seen nurses who handle patients extremely dangerously, which is, again, not good for patients who are in a hospital. But it also just makes their healing a lot worse, because you want to be in a setting where people care for you. They're doing the best work that they can to help you get better. And if you're with a nurse or a nursing assistant who doesn't like their job and isn't doing their job, that makes that healing process a lot harder. So,
I totally agree with you. I think if you want to get into healthcare and you are getting in it because you're only thinking about the money, I would say take a course, go check it out and see if it's something you would like to do. But obviously, if you do like helping people, if you would enjoy everything you do, and then whatever specialty even you decide to go in the future, you would love what you do, right?
Yeah, of course.
You're happy. I get exhausted, and I'm sure the PCTs also do. Like you guys get tired from work, but you also feel satisfied that when you provide a care in a certain way, that even if you are exhausted, you go home and you go like, I'm happy with what I did today. I'm glad I was able to achieve all these things today, although I'm tired, right? So
for sure.
It's always good to check it out before you put yourself in it. But it's a rewarding job.
Yes, I totally agree.
It's a rewarding job. If somebody's young and have a lot of time ahead of them, it's something I think they should do, especially if you are considering even I don't know, what do you think about pharmacies even trying that out?
Yeah, no, I totally agree. I mean, I think it's when you're a nursing assistant in the hospital, I think you see almost every profession in the hospital, even if it's for a brief moment, because even X-ray comes up to the patient's room and you'll see them do their job. And it's like, oh, you see a glimpse of, what maybe you want to do. And even then, if you see something that, oh, I might like that, you can always reach out to them and be like, hey, would it be possible to shadow you? And I'm like interested in this field of work. So I definitely think working in a hospital, whatever it may be, nursing assistant or something else, I think you definitely are exposed to many different professions. And, if it's not for you, then you even can go into phlebotomy or even, there's so many different things. So yeah, for sure. Yeah.
And then so before we end, I'm going to
Mhm.
throw you on the spot here.
Yeah.
Can you tell me something that you wish all nurses do
More. Yeah.
do more? Yeah.
I think, like we said earlier, I think they delegate a lot. I had a fun little story.
Yeah, I love to hear that.
I had a nurse who asked me if I could help get a weight on a patient. This person was, a 2-person assist to stand, and we decided to do the standing weight. So, gait belt on, ready to stand up, both of us on either side. We stand her up on the scale, we get a weight from her, and then we sit the patient back down, and the nurse just walks out of the room. And I just, I'm kind of sitting there. And obviously my first priority is to get the patient back to bed, get comfortable. And it's, this was an evening shift. They're getting ready for bed. So luckily the patient was very petite, and I was able to, lift the patient in bed by myself, get the covers on, put the scale away, and I opened the curtain, and the nurse is at the nursing assistant or at the nursing station on their phone. And I'm like, where did you go? It would have been a little different if you were like, hey, I need to pass meds to a different patient.
Yeah.
I'm really busy. I need to go here. But without even announcing, what they're doing, I think So I think a big thing is communication. Communication between the nurse and the nursing assistant is huge.
Yeah.
And if there's no communication, someone's going to be picking up work that they shouldn't be doing by themselves. So
I know. Yeah. And it stems from my experience as a PCT, right? Before I pass on something, I feel like it's something I really need to pass on, right? Just because, for instance, like, if I would ask a PCT to give a patient a water, like a cup of water, it's only because I'm running behind, and I need to get somewhere. Other than that, water. So exactly. But just like saying, leaving when it's a 2-person, I think, everything else can wait. The patient safety is priority, right?
For sure, yeah.
And so if you have to get the patient back in bed safely, you have to be there to help the PCT or the CNA to do that, right?
Yeah.
They just don't work out.
Yeah. And I think a lot of the nurses too, sorry, I shouldn't say a lot of the nurses, but I've experienced a lot of nurses when they go into a room, I think when you go into a patient's room, you always need to understand that you should get everything done that you need to get done in that room so that you don't need to come back multiple times. And I think a lot of the time nurses don't, or they're unable to do that. And they then delegate the rest of the work to the PCT, which is okay if it's one small thing like, hey, I'm rushing around, this and that. But if it's like consistent, then it's like, this is getting tiring.
And just like we said earlier, when even somebody delegates stuff to you, you know people, this person doesn't do that.
Exactly.
If they're doing it, it's because they need it.
For sure.
Versus there are some people they just do it just for the...
For sure. Yeah. Because people make mistakes. I know I've had nurses call me and be like, hey, can you go do this? And I'm so busy that I completely forget. And I'm like, oh, I'm so sorry. You know what I mean? Like, it's not an everyday thing. And, but if it's consistent, then it's like, okay, there's a problem here. So
even if I ask, like, let's say, even if I ask a PCT, can you check your blood sugar for me? Or check a vital sign on this patient for me? And let's say, just like you're saying, I know I've been there before, so I know sometimes you could easily forget. And I go to get it, I don't get mad about it. I just say, hey, don't worry, I got it. Just like you're saying, communicating with them.
For sure.
I've been able to get to it. I've got it. Don't worry about it. So it's very important to communicate.
For sure.
What about the opposite? One thing that you think nurses do that you don't like at all?
That nurses do, or nursing assistants?
Nurses do that. As a nursing assistant, you're like...
I think the big thing is just, not communicating, giving me... And I think when we're short-staffed, or when there's, we have 15 patients and you have 3, and you're like, okay, you could have done the vitals or something like that in a patient's room. That I have 10 patients or 15 patients. So I think, obviously we don't have to give meds or anything like that. And nurses have like, what is it, 3 to 5 patients a night?
Yeah,
Or
yeah,
3 to
three,
5,
four, three,
4,
yeah,
3 to
depending
4.
on the unit you work.
Yeah, exactly. When, nursing assistants at night or even during the day, it can range from anywhere from 7 to 15 patients,
Yeah.
which is, almost triple or quadruple the amount of patients that
Yeah.
nurses have.
Yeah.
Again, obviously, we don't do as much work as you
Yeah.
do, but we do a lot of the heavy lifting and the cleaning. And sometimes you get stuck in a room for like 40 minutes. So it's like, answer the call lights or whatever. Like, just little help like that would be great.
Yeah.
But I mean, obviously, I know nurses do so much. It's
Yeah.
like we try to help you guys out. It's like there's not much we can do. But
Yeah, and it's
yeah.
true, right? It's good.
Yeah.
It's good for PCTs also to understand like
Mhm.
the workload on nurses.
For sure,
and
yeah.
how as somebody who has been a PCT before or a nursing assistant before, I used to get home physically exhausted
Yeah. Mhm.
as a CNA,
Yeah.
but as a nurse, I
Mhm.
got home both physically and mentally exhausted.
Yeah. No, for sure.
Yeah,
Yeah.
and that is the difference
Yeah.
for somebody who has been a nursing assistant before and then transitioned to the nurse. I feel
Yeah.
like that's one thing I learned about, the difference between these two jobs.
Yeah.
As a nursing assistant, you do a lot of physical work. You get home
Yeah.
very tired physically,
For
but
sure. Yeah.
as a nurse, you get home mentally tired because you are reading orders all night. There are new orders coming in. You are assessing patients. You are trying to
For
understand
sure.
what is going on and how
I
best you
agree.
can help this patient, right? So
Yeah.
you got home both physically and mentally tired, right?
Yeah.
But
For sure.
again, it's within our scope.
Mhm.
Everything that the PCT does or the nursing assistant is
Yeah.
the responsibility of the nurse. Ultimately, is the responsibility of the nurse. So just like I said, communicating with the CNAs or the nursing assistant, letting them know what you really
Yeah.
need or want to do. They understand, right? I'm sure the nursing assistant do understand.
Yeah,
the need
no,
of the
for sure.
nurse.
Yeah, because ultimately we assist you guys. You know what I mean? And it's if there's something that you need done and you're not communicating that with us, then there's miscommunication, and then you're expecting us to do something that we have no idea what to do. You know what I mean? But no, I definitely agree, because at the end of the day, we can always be like, "We'll get your nurse." You know what I mean? Like,
Yeah.
we'll get your nurse. So a lot of the like emotional things, even if like a patient is, complaining of one thing and needs to talk to the doctor, we can just be like, "Hey, I'll get your nurse." And then like that's the end for us.
Yeah.
But you guys actually have to go up the chain, get orders from the doctor, talk to the doctor. So you guys do a lot more, obviously, obviously. But so yeah, just communication's huge. So
yeah, I know. And
Mhm.
and it's good that we all understand that we play a very important role in the healing process for this patient.
Yeah.
And as a nurse, I always say, and without a nursing assistant, our job will be more challenging. Even with the nursing assistant, we complain that we don't have enough time to attend to patient.
Yeah.
And so without you guys, I don't know how much attention we can give to the patient, right?
For sure.
And that does not help in the healing process. So
Yeah.
I think you guys play a very important role. And for me, I really appreciate our
Yeah.
NAC's
Good.
assistant. So,
Thank you.
yeah, and any final words before we end this show today?
Well, I think obviously nursing assistants have, many things that I'm sure they could complain about nurses, but at the end of the day, we appreciate everything that you guys do, because nurses are amazing. So yeah. So thank you.
Yeah. So I'm representing all of this here right now.
Yes.
And thank you to for all that you guys do, and thank you also for coming on this show.
Of course. Yeah.
The goal of this show actually is to showcase all the different roles in the healthcare system that support the patients in their healing process, and support the nursing team in the healing process. So, when we talk about care coordination, it's not just from nurse and then post inpatient care, right? There's a lot of teams that work together in the inpatient setting that support the patient healing. And nursing assistants are one of the team members in that process. So thank you for joining us, and thank you for staying tuned to this time. And then hopefully we come your way with the next episode. Thank you for staying. And if you are watch us on YouTube. You can find us on YouTube and also on Spotify. And until we see you in the next episode, thank you for watching. And this is the Healthcare Beyond Scrap Show. Have a good day.